On a normal day, I'd start by telling you about the highly concerning testimony we heard today about the Attorney General of the United States, William Barr, who a federal prosecutor told the House Judiciary Committee today acts based on political considerations to appease and placate Donald Trump, in this case, reducing Roger Stone's sentence. I might also have told you about a federal appeals court's ruling to order a judge to dismiss the case against former National Security Advisor Michael Flynn at the request of the DOJ, despite the fact that Flynn twice pled guilty to lying to the FBI about his communications with the Russian ambassador. Or I might mention the fact that the Republican Senate confirmed its 200th judicial nominee under Trump today. 200 people Donald Trump has managed to put on the federal bench for life, deciding cases like these and shaping our legal system for decades to come. But this is not a normal day. Released this morning, a scathing and disturbing to the core report highlighting massive failures surrounding the Soldiers Home in Holyoke, where at least 76 veterans have died of COVID-19 since March, and more than 80 staff members have tested positive for the virus. Much of the 174-page report focuses on actions taken by the superintendent at the time, that's Bennett Walsh, who was put on administrative leave by Governor Baker. As investigators put it, quote, some of the critical decisions made by Mr. Walsh and his leadership team during the final 2 weeks of March 2020 were utterly baffling, an assessment the governor echoed today.
The subject matter and details of this report are nothing short of gut-wrenching. In fact, this report is hard to read. Veterans who deserve the best from state government got exactly the opposite, and there's no excuse or plausible explanation for that.
Ahead of the report's release, Secretary of Veterans Services Francisco Urena resigned last night. And to Governor Baker's credit, whenever he spoke this afternoon of that department falling down on the job, he quickly said it was, quote, our administration, and did not distance himself from this. But back when the governor joined us on Boston Public Radio in mid-May, and we asked him when he learned about what was happening at the home, here's what he told us.
The first I heard about it, obviously, was that phone call on Sunday night in late March when the lieutenant governor, Secretary Sutters, and I were all on the phone together, and Alex Morse reached out to the lieutenant governor. But I am waiting on Mark Perlstein's report. You know, documents and emails and interviews will answer a lot of these questions. And I'm
but can you at least say that nobody in your administration did know about it until that Sunday night?
Well, I can certainly tell you that the lieutenant governor, the secretary, and I were shocked by that call with Mayor Morse. I can't speak to anybody other than that.
But questions remain: who knew what and when? Some of the details are truly horrible, like what happened on Friday, March 27th. After several staff called in sick, and because of the staff shortage, they consolidated one of the home's 2 locked dementia units with the other. The report calls that decision a catastrophe, with one staff member saying she, quote, will never get those images out of my mind, what we did, what was done to those veterans, and thought, my God, where is the respect and dignity for these men? Where was the respect? I'm joined now by State Representative Vega, he's from Holyoke, and Kwesi Ablordeppey, he's an aide who has worked at the home for 20 years and who says he cannot sleep at night thinking about the conditions the veterans had to face. Gentlemen, thank you so much for joining me. Representative, starting with you, are your major concerns addressed, your questions answered by the report released today?
I think, Jim, thanks for having us, and thanks for having this hard conversation. I think that a lot of the questions are addressed. Some of them are answered. I think in the end, there's some good recommendations in the report, but I still think there's some missing elements. I think, especially around the hiring of Bennett Walsh, I think there's some gaps there. I don't think that many of the board members were interviewed from that time period, so I think there's some gaps there. But I think overall, getting the timeline straight, hearing from the residents, as difficult as it was to read, I think that a lot of it is addressed, but we still have 3 other reports out there, 3 other investigations that should be moving forward.
But, you know, what I have to say I don't understand from the eastern part of the state, the mayor said he knew nothing till he got an anonymous tip on Saturday, the 28th of March. The governor told us he knew nothing about it till Mayor Morse called the lieutenant governor on the 29th. Did you know anything about what was going on inside the home prior to the? How is that possible? How is that possible?
This highlights some of our frustration. And those of us in Western Mass, my colleagues, which I'm not speaking for per se, but we all have a good relationship at the Soldiers Home. We all have good communication with Bennett Walsh. And to not hear from him that entire week, I texted him on Friday of that weekend. I had started hearing some stuff from some people that I know that worked up there. I didn't hear from him, and I didn't hear anything until Sunday night, Monday. And I never got a call
well,
from
apparently the communications were not as good as you had thought.
No.
Kwesi, you were there while much of this was happening. Can you describe what you saw that makes you unable to sleep without telling the story?
Yeah, first of all, thank you for having me on.
Sure. Thank you.
What I saw was something that I couldn't fathom it. The reason why I am saying this, we have specialists, those who have been to school, those who knows the consequences of infection. We know people that when one floor is being infected, and you have another floor which is not, why do you combine the two? You see, this is where it baffles me a lot. And I look at it, I say, no, this is not right.
When you saw men dying there, was there a feeling of helplessness? Were you expecting help to come? What were you thinking?
Yeah, it's something that I always go to bed and keep on thinking about it. It's like, how do we do this? Seeing people dying, I saw some of the veterans dying in front of me. And I can't remember that night. One night when I went to work, I have to put 2 veterans in a body bag and put them in a refrigerator, which is mind-boggling, which is something that we could have prevented it. I mean, I'm sorry, it's not right. It's not right.
Representative, if I can get you back in the conversation, it seems to me there's a parallel between another horrible thing we lived through a year or so ago when those motorcyclists were killed in New Hampshire after the state registry failed to check some notices from other states. In that case, a mid-level executive, the registrar, said she didn't tell anybody above her in the hierarchy. Here, Secretary Urena, while he did share some information with the deputy of HHS and Cy, with his boss, Mayor Lou Sutters, about at least one positive case a week before, the bulk of it apparently was not communicated. Is that failure of communication a reflection of the administration, or did the legislature fail in its oversight job to make sure the executive branch is working properly?
Well, I think we put forth in 2016, going to your oversight question, as you know, legislation to put a new position in to oversee both the Holyoke Soldiers Home and the Chelsea Soldiers Home, who would have a medical background and the right credentials to know what's going on in those kind of facilities. And that was not funded. And I think there's going to be some more discussion on that, whether it was the administration or the legislature that didn't fund that position.
But you knew there were staff shortages. You knew there were staff shortages. The staff, I don't know if you're in these meetings, Kwesi. The former directors, Mayor Lou Sutters, met with the staff in December 18. Were you at that meeting, Kwesi, with the secretary?
Yeah, I've been in. You asking me, right?
Yes.
Yes, I've been in most of the meetings. And the underlying issue, the major agenda on the agenda is staffing issues that we having in the Holyoke Soldiers.
And how are the staff? Kwesi, temporary staff was even more detrimental. The use of temporary staff that wasn't hired using temp agencies during this pandemic was one of those, when all those call-outs, a lot of them were not organic staff. They were hired temp staff who were working in multiple places.
Kwesi, what is the state of mind of you and your coworkers who had to live through this horror, watching so many people die? How are people doing?
I would say a lot of people are having a flashback, and people are not even at their normal stage. Okay, people are going to bed without sleeping, coming to work because they still remember some of the veterans that we are attached to. Okay, most of them we are attached to them because we don't have the family there 24/7. we, the staff, we have represent the family in the home. So to see all these veterans going down, dying, is something that it will take a while for us to, to recover from this.
You know, Representative, you may be aware that we passed the 5,000 mark today of COVID-19 deaths for people in long-term care facilities. I believe overall we have the second highest percentages of long-term care deaths as a percentage of the total number of deaths. Are we looking into that? I mean, obviously that is of great concern, not just at Holyoke, which is the worst example, but beyond.
Absolutely. I think you see the differentiation, the differences between oversight. What's DPH oversight, what's Health and Human Service oversight, what's VA oversight, it's complicated and it's not right. And a lot of it's based on billing, which we know. So yes, I think there's definitely a failure in oversight. And I don't know. I mean, it's hard. It's easy, I guess, in one way to say, oh, the administration didn't act quick enough at the Soldiers Home and other places. Maybe they didn't, but did they have the protocols in place for something like this? I don't even think we had protocols in place for something like this. Infection control, there was nobody at the Soldiers Home that was professionally trained in that, and that those that weren't being listened to. I mean, some of the worst parts of the report is hearing staff, like we have here today, who've been there for years, asking to wear masks and being told they couldn't wear a mask when they're serving a veteran who's growing up. I mean, regardless of COVID-19, yeah.
Kwesi, do you have any doubt that if Walsh and other people in high places had done their job, that fewer men would have died?
Absolutely. Absolutely. Because we have one empty space. We have one empty space which we have dedicated that when somebody is contracted with this disease, the person has to go in isolation in that particular site. Okay? But they didn't. And secondly, why is it that they remove all the masks from the floor during the pandemic period?
You know,
done by the infection control manager.
It seems to me that it's indisputable that people died, representatives who didn't have to die. And today, when I listened to the governor, who I think evinced real human concern, the Secretary of Veterans Services resigns. Walsh is on administrative leave, and the governor said he'll be dismissed. Is that enough of a consequence for being in charge and allowing, if not causing, but at least allowing 76 people who served this country to die on their watch? Is that enough of a consequence? Is that all there is?
No, absolutely not. I don't think that is all there is. I mean, let's be honest. I mean, one of the reasons why Secretary Urena resigns the day before the report comes out, right, is that we don't have to cover his legal costs, right? I mean, so this is going to go to court. There's three more. There's an IG investigation, an AG investigation, and the U.S. Attorney investigation.
U.S. Attorney.
So this is not done. And Senator John Velas and I are pushing the Veterans Affairs Committee to have an oversight hearing as well, similar to what you brought up with the incident in New Hampshire, right? So, of course, you know, the administration, executive office does their work, but we have to do our work because you're right. There's going to be some legislation, some oversight legislation that has to be figured out and streamlined. And again, that position that we created in 2016 needs to be funded, and I don't know why it wasn't.
Somebody's got to protect these people, and somebody's got to protect the workers. Kwesi, Representative, thank you, gentlemen, for joining me. I really appreciate your time.
Thank you.
Thank you.
Thank you.
Representative Aaron Vega and Kwesi Ablordeppey.